We've been living in a COVID world for more than 18 months now. At the outset of the pandemic, government agencies and health authorities scrambled to inform people on how to identify symptoms of the virus. But as the virus has evolved, it seems the most common symptoms have changed too. The latest and most powerful variant is the Delta variant, formerly known as the Indian variant. This highly transmissible COVID-19 Delta variant was found in India in December 2020. It's now the dominant strain in the US and several other countries. Top symptoms reported include headache, sore throat, runny nose, fever. A cough is becoming less common and loss of smell is no longer listed in the top 10 common symptoms anymore. The coronavirus and its variants have a wide range of symptoms in common, too. Those include fever, cough, shortness of breath or difficulty breathing, and congestion. While a sore throat may be witnessed in those contracting the original strain as well as the Delta variant, those who get the Delta variant do not commonly exhibit a loss of taste and smell. In an even more confusing twist, the onset of British summer time as a period in which many hay fever sufferers find themselves feeling under the weather has clashed with the spread of the Delta variant and some of its very hay fever-like symptoms. These include headaches, runny noses, sore throats and fevers. Where the Delta variant differs to classic coronavirus symptoms is that they are more similar to cold and flu-like symptoms, with many finding themselves testing positive as a result, saying they felt slightly off or unwell rather than experiencing a sudden onset of symptoms such as a loss or change in taste or smell. The most common symptoms for coronavirus on the whole, according to the NHS, are a new continuous cough, high temperature and a loss or change in taste or smell. The differences in symptoms comes as a result of the virus mutating, with slight differences or changes in symptoms to be expected. Despite this, however, the advice remains very much the same, with those feeling unwell advised to order a lateral flow device test or to stay at home and order a PCR test if they are experiencing any of the signs of coronavirus and its latest variant. Researchers are concerned people may mistake symptoms for a bad cold and avoid quarantine, helping the variant spread. When it comes to being infected by a viral infection, it can depend on two factors. One pertains to the viral factors, whereas the other involves the host factors. The viral factors include the rate of infection, the speed of the replication, mode of transmission and more. It changes with the mutation of the virus. On the other hand, host factors take age, gender, medications, diet, exercise, health and stress into consideration. Therefore, when it comes to signs and symptoms of a particular virus, ample data needs to be collected from individuals to ascertain the most common out of the many. Since the Delta variant is a mutation of the original strain, it is said that the symptoms may also have altered during the course of mutation. According to a self-reporting system through a mobile app, data from the United Kingdom suggests the most common COVID symptoms may have changed from the original COVID symptoms. As is known, viruses are programmed to mutate into new strains. According to the WHO, a virus replicates or makes copies of itself, which is usual. These changes, by definition, are called mutations. A virus with one or more new mutations is referred to as a variant of the original virus. That said, when it comes to SARS-CoV-2 virus, it has mutated into many strains, of which the Delta variant. It's spreading fast. As of June 14, 2021, the Delta variant has reached 74 countries, just 6 months after discovery. In the UK, it's already overtaken the Alpha variant in number of cases. That variant is thought to be 43% to 90% more transmissible than previous COVID-19 variants. Experts believe Delta is anywhere from 30% to 100% more infectious than Alpha. Over a year has passed since the novel coronavirus impacted our lives in many ways. Not only did it take a massive toll on our lives but also deprived us of our mental well-being. Now, with the new emerging variants, it does not get any better. As per experts, the new variants, like the Delta and Delta Plus variants, have evolved greatly and pose more risk to human life. Additionally, as per recent findings, the symptoms experienced from the Delta variant may also differ. Researchers are still unsure why the Delta variant is so much more transmissible than others. They think changes in the variant's protein might make it easier to enter human cells. Another early study suggests that a mutation in the Delta variant might help it blend better with human cells once it attaches itself. If it can easily blend with your cells, it's able to infect more of them and overpower your immune system. It seems to affect younger people more often. In the United Kingdom, studies showed that children and adults under 50 were 2.5 times more likely to become infected. Symptoms appear to be more severe. People may be more likely to end up in the hospital if they have the Delta variant. Studies suggest it might have almost double the risk of hospitalization than the Alpha variant. In China, doctors say patients with the Delta variant are sicker than those they treated early in the pandemic. And the condition seems to go downhill much faster. While fever and cough have always been common COVID symptoms, and headache and sore throat have traditionally presented for some people, a runny nose was rarely reported in earlier data. Meanwhile, loss of smell, which was originally quite common, now ranks 9th. There are a few reasons we could be seeing the symptoms evolving in this way. It may be because data were originally coming mainly from patients presenting to hospital who were therefore likely to be sicker. And given the higher rates of vaccination coverage in older age groups, younger people are now accounting for a greater proportion of COVID cases, and they tend to experience milder symptoms. It could also be because of the evolution of the virus, and the different characteristics, viral factors, of the Delta variant. But why exactly symptoms could be changing remains uncertain. While we still have more to learn about the Delta variant, this emerging data is important because it shows us that what we might think of as just a mild winter cold, a runny nose and a sore throat, could be a case of COVID-19. This data highlight the power of public science. At the same time, we need to remember the results haven't yet been fully analyzed or stratified. That is, host factors, such as age, gender, other illnesses, medications and so on haven't been accounted for, as they would in a rigorous clinical trial. Evidence indicating Delta is more infectious compared to the original SARS-CoV-2 and other variants of the virus is building. It's important to understand the environment is also changing. People have become more complacent with social distancing, seasons change, vaccination rates vary, all these factors affect the data. But scientists are becoming more confident the Delta variant represents a more transmissible SARS-CoV-2 strain. As we face another COVID battle in Australia, we're reminded the war against COVID is not over and we all have a role to play. Get tested if you have any symptoms, get vaccinated as soon as you can and follow public health advice. Thanks for watching. PLZ, like and subscribe to our channel for more updates.